Injury to the spinal cord causes varying degrees of functional impairments depending on the site and completeness of the injury. Complete spinal cord injury refers to a full transection of nerve tissue causing a loss of sensory motor function relating to the site of injury. Efferent and afferent pathways at the injured site will lose their ability to transmit action potentials, resulting in a loss of function in areas of the body innervated by nerve roots distal to the level of injury. Incomplete spinal cord injury will have sparing of some of the nerve connections in the spinal cord, allowing partial preservation of sensory-motor function past the site of injury.
Complete spinal cord injury at the C5 level will cause tetraplegia and loss of sensation below the neck. Patients will typically exhibit diaphragm weakness, impaired inspiration, and lack of cough strength, but may regain the ability to breathe independently with time. Patients will also have reduced movement of the chest wall, reduced lung volumes, and higher risk for respiratory complications such as pneumonia and atelectasis.
Meet John Smith. John has a wife and 2 children who live with him at home. One weekend, John had a diving accident and was airlifted to the Victoria General Hospital immediately afterwards for emergency care. Upon arrival, John is intubated and mechanically ventilated. Within 1 day, John is tracheostomized, and he is informed by his nurses that his tracheostomy will make him more comfortable and might allow him to be able to speak again.
John undergoes an MRI to confirm the spinal cord injury and is then examined in order to determine both the level of injury and whether it is complete or incomplete. The neurological level of injury and American Spinal Cord Injury Association impairment scale are used as prognostic factors to determine severity. The NLI examines all dermatomes and myotomes in the upper and lower extremities and tests both sensory and motor function. It was determined through the use of the NLI that John sustained a complete C5 spinal cord injury, meaning that proper functionality below the C5 level is unlikely. As a result of injury, John develops a number of respiratory deficits, resulting in an inability to independently manage his airways. He experiences a reduced vital capacity, insufficient respiratory muscle use, and an inability to produce an effective cough. John is thus referred for physiotherapy intervention. While John is in the hospital, his physiotherapist helps with secretion clearing techniques and breathing techniques. John's physiotherapist uses proper positioning, like chair sitting, to optimize ventilation, and uses manual percussions to help mobilize secretions. The physiotherapist also performs suctioning to remove secretions that John is unable to expel on his own. The healthcare team's main goal at this point is to wean John from the ventilator and have him breathing independently. To accomplish this, the physiotherapist completes a respiratory assessment and determines that John is a good candidate for weaning.
They begin spontaneous breathing trials by occluding his tracheostomy with a cork, forcing John to breathe on his own. The frequency and duration of these trials are increased gradually as John can tolerate. After 2 weeks of ventilator-free breathing with no signs of respiratory distress, John's tracheostomy is removed, and his breathing is done independently and voluntarily.
John is referred to the Nova Scotia Rehab and Arthritis Centre, where his cardiorespiratory physiotherapist focuses on the promotion of optimal breathing mechanics, lung and chest wall expansion, and breathing techniques to maintain his airway and prevent infection. The physiotherapist uses a cough assist machine that provides bidirectional pressure to inflate and then quickly deflate the lungs to simulate coughing. The physiotherapist also teaches John a breath stacking technique, which involves the use of an inflation bag with a one-way valve to assist him in achieving his total lung capacity, promoting chest and lung expansion while improving cough effectiveness and reducing the risk of developing respiratory complications. John also begins inspiratory muscle training, which provides resistance on inhalation. Once he is effectively clearing secretions on his own, develops an improved cough, and his other treatment goals are met, John, his family, and healthcare team prepare for his discharge home.
His physiotherapist has recommended that he make appointments for home physiotherapy or outpatient care to facilitate continued improvements and prevent decline in function. Prior to discharge, the physiotherapist makes sure to properly educate John and his family on the importance of treatment adherence and lung function maintenance so that he can avoid complication.
John is currently living at home with his wife and children who help him to achieve his activities of daily living. John completes his breathing exercises every day to maintain his lung function and avoid respiratory complication. Unfortunately, John is not the only one affected by this type of injury. It is estimated that over 85,000 Canadians are currently suffering from spinal cord injury, with men between the ages of 20 and 35 being the most affected. 1,785 new cases of spinal cord injury occur every year, and 56.7% of these new cases occur in the cervical spine. Physiotherapists have valuable contributions to the management and treatment of cervical spinal cord injury, from ICU admission to outpatient rehabilitation.